Ms. Ling.
Madam Deputy Speaker, I would like to first declare my role as an independent consultant in healthcare transformation projects. Madam, I give apples to my Jalan Kayu residents at every house visit starting from the start of this year. This gives me an opportunity to share with them about healthy living, a key theme that I promote in Jalan Kayu besides sustainability and intergenerational bonding. An apple a day keeps the doctor away. This 19th century proverb sounds simple, but it's not always easy to follow. In my COS speech in March, I spoke about my concern for the increased prevalence of chronic diseases such as high blood pressure, high blood sugar, and high cholesterol in our population, not just among our seniors, but also in some of our younger people. I recognize that our national budget for healthcare will inevitably have to increase in order to create better health and quality of life outcomes for our people. But I also suggested to manage the workload on our healthcare professionals by empowering Singaporeans to take more ownership of our own health and participate whenever possible with our healthcare professionals on our treatment or health plans. I thus read the Healthier SG white paper with great delight, that we are indeed embarking as a nation towards a much healthier way of living with stronger emphasis on preventive care, building relationships and trust with our family doctors to maintain our health, supported by each of our own community right in our neighborhood. This is transformative healthcare policy in my view. It will also require a transformative mindset from our people to fully reap the fruit of this healthcare policy breakthrough. But we can take heart that we will have our neighbors to walk the journey ahead with us together. For my Jalan Kayu residents, you have your MP who will walk this journey with you. All good policies can only be as good as how well they are implemented. That is when the tires hit the road, so to speak. I will focus my speech on clarifications with the Ministry of Health on 3 implementation considerations. 1, awareness of subsidized preventive health screening. 2, enhanced community partnership and participatory approach to collective health. And 3, enabling seniors through simplifying healthcare technology. Firstly, I would like to know how MOH will be tracking and reporting the usage of the enhanced subsidies provided under Healthier SG to encourage Singaporeans to adopt more preventive health behaviours. The white paper outlined MOH's plan to fully subsidize nationally recommended vaccinations and screenings, as well as an onboarding health consultation with their chosen family doctors upon enrollment. I would like to clarify what types of vaccinations and screenings will be fully subsidized. Are they those that are under the existing Screen for Life program, or will there be more added under Healthier SG? What is the participation rate for Screen for Life for Singaporeans above 50 years old currently? And what improvement does MOH aims to achieve under Healthier SG? From my MPS experience, whenever I ask my residents in need about their awareness of Screen for Life program, I will usually draw a blank look. For the handful who may be aware, they will admit to me their fears of finding out illnesses that will cause them more to treat and affect their jobs. I believe for preventive health behaviors to improve significantly in Singapore, MOH must invest more in creating the right awareness and assurance of benefits of preventive health screening and the follow-through care that Singaporeans can expect. This should be done in more mass media and vernacular languages, including even some dialects, to correct the misinformation that screenings will lead to more problems. Secondly, I would like to propose strengthening the community participatory approach so that our busy family doctors, whether they are practicing in the GP clinics or polyclinics, will know and have quick ways of connecting with their community, sports, and social service counterparts when they see patients that need support beyond medical treatments. The white paper proposed to rally a group of community care partners to support residents in leading healthier lives. The white paper mentioned the People's Association, Sports SG, and AIC's Silver Generation Office to help organize healthy living programs for residents. It also mentioned plans to tap on the elder care centers to serve as the community care connectors for seniors to help them follow through the recommended lifestyle interventions prescribed by their family doctors. Although I'm fully supportive of this approach, after speaking with a few GPs in my Jalan Kayu constituency since the release of the white paper, I noted their concerns on their bandwidth to activate such community partnership to care for their patients who are my residents. There were also questions on seniors who are living in the private estates, such as those who are living in the Seletar Hills East and Jalan Kayu private estates, where some of my older residents live. The existing elder care centers are usually located nearer to rental blocks of each constituency. I would like to ask how MOH will also support the social prescriptions by family doctors for the senior residents living further from elder care centers, including those living in the private estates. Lastly, I understand that enrollment will start next June, beginning with our older residents aged 60 years and above first. This is good, as we should always prioritize the health of our seniors first, given their higher risk of developing health challenges. The white paper proposed Health Hub app and Healthy 365 app as the digital front doors of Healthier SG to encourage and nudge residents to adopt healthier lifestyles. I understand that the Health Hub app will have a digitally enabled health plan where residents can access and track their health outcomes. This will be complemented by Healthy 365 app, which allows tracking of physical activities and diets, as well as supports their access to community activities. Like fellow Honourable Member Dr. Tang Wu Ming, several studies that were published between 2020 to 2021 shared that there is lower interest in adopting mobile health applications and digital health services among seniors, despite the convenience that it presented during the COVID lockdown. Thus, I would like to clarify with MOH on the current adoption rates for these two apps by seniors population above 60 years old. And if the take-up rates has been low, similar to my fellow Honourable Member, Ms. Denise Phua, I would like to ask how MOH intends to help our seniors utilize these two apps after they have enrolled with their family doctors under Healthier SG. Madam Deputy Speaker, please allow me to say some words in Mandarin. 预防胜于治疗这句惯用语不仅涵盖了我们对预防保健的理解，这也是健康新加坡白皮书所提出的核心概念。通过预防性保健，我们可以协助每个国人改善健康以及提高生活素质。在我们日趋老化的社会里，预防性保健也能减少对医疗体系和个人的负担和开销。若我们想达到人人健康，那我们就必须康健人人。因此，我非常支持卫生部在白皮书里所提出的计划。与此同时，我希望对白皮书里的计划提出3点建议，以便帮助居民更有效地接纳预防护理措施来改善自己的健康。第一，我希望卫生部能够提供更多有关预防性体检的公民教育与资讯，促进居民接受这些体检。卫生部现在所推出的 Screen for Life 体检计划，涵盖慢性疾病以及一些常见癌症，如直肠癌的检查。我希望卫生部能够进一步在健康新加坡计划下加强公民教育，甚至应用马来语、大米尔语或者方言，让更多国人，尤其是我们的年长者，能够了解这些预防性检查的益处，鼓励国人接受预防性检查。第二，我也希望卫生部能够以社区参与行动的方式，结合家庭医生和社区伙伴的合作，秉权于居民，与他们共同针对他们的健康所需，完成个人健康保健计划。不仅如此，在社区里，通过3大区域医疗系统和协调，找出区域里常见的通病，并与政府部门如人民协会、 与关爱乐龄办事处以及居民们的共同合作，举办有益居民健康的保健活动。当我们通过这个方式，让居民能够掌握对自己健康的了解和主导权，居民便会更容易地接纳预防性保护措施，这也能加强健康新加坡的生态圈。最后，我也希望卫生部能够改善 Health Hub 和 Healthy 365的手机应用程序，以方便年长者的健康新加坡计划下能够方便使用它们。我也希望卫生部能够与资讯媒体局，就是 IMDA 合作，通过资讯媒体局的数码乐龄计划 Senior Go Digital 推广 Health Hub 和 Healthy 365应用程序，并且实际教导年长者如何使用这两组医疗手机应用程序，以及介绍他们的主要功能。我希望当年长者体验到这手机医疗应用程序的好处后，能够通过口耳相传的方式，帮助进一步推广健康新加坡计划。Madam Deputy Speaker, back in English. In closing, I would like to speak up for a group of healthcare professionals who have become my friends in my 4.5 years of involvement in healthcare sector. They are the family doctors working both in GP clinics and public polyclinics. They are a group of highly intelligent, motivated, and committed healers in our community. The falling year of one family doctor in a busy polyclinic can mean the rest taking up much higher patient load for the day, sacrificing lunchtime or even any breaks in that day. I hope that MOH will continually invest in helping them reduce unnecessary administrative workload. To the Minister for Health, Mr. Ong Yi Kang, I agree that administrative work that is required for claims are very necessary, but I think we should study in some of the areas that maybe we can reduce it from the professionals. This can include doing away with the need of issuing medical certificate for mild acute illnesses like coughs and colds, which my fellow honourable member, Ms. Mariam Jaafar, has raised earlier in a parliamentary speech she made. Well, this will require the support of MINDEF, MOE, and NMOM. Countries like the United Kingdom that has practiced doing away with MC for absence from school and work due to common cold and coughs have not seen students of all employees abusing such move. Also, more use of telehealth that can augment and take away some of the family doctors' repetitive tasks should continue to be invested into and subsidized by MOH. No doubt that Healthier SG will take time, I think at least a decade, before we can see a healthier population coming to fruition. Nevertheless, as a strong advocate of healthy living and active aging, I commend MOH for taking this bold step towards reshaping Singapore's population health. And with the collective and united efforts of all Singaporeans, we will get there. Notwithstanding my considerations raised, I strongly support the white paper on Healthier SG. Thank you.